Now, so in terms of nervous system regulation, for this class, I think that's already a lot. So you just need to, or for this class, know that baroreceptors, these specialized neurons that detect pressure, are important in telling the brain, hey, do we want to speed up the heart? Do we want our blood vessels to relax, or do we want them to constrict a bit? And that can cause an increase or decrease in blood pressure. Now, how about hormones? Well, there are many hormones that can affect blood pressure, but for this class, I'll keep it limited to this list. So epinephrine, norepinephrine, which we covered last semester and this semester, and then antidiuretic hormone, which we did cover earlier this semester, aldosterone, angiotensin II, this is new, and ANP and BNP, which we did cover briefly in the heart chapter. Now, ANP and BNP we already covered earlier, so if you need more details, I already have a lecture on that. Okay, let's do the recap of Epi and Norepi, or again, in the United Kingdom and Australia and other Commonwealth countries, they tend to use things like adrenaline and noradrenaline. They're one and the same. It just depends on which institution you are in. So the hypothalamus innervates through a chain of the sympathetic nervous system, it innervates the adrenal medulla, right? So what does it tell the adrenal medulla to do? It's going to secrete epinephrine and norepinephrine. Now, what does epinephrine and norepinephrine do? Well, many things, but in terms of the cardiovascular system and blood pressure, what they're going to do is bind to alpha-1 adrenergic receptors. Well, there are actually many adrenergic receptors on blood vessels, but when you're talking about general systemic blood vessels, alpha-1 is the one that causes a constriction. So a neat mnemonic I learned from the previous instructor is that you have alpha-1 and alpha-1 constricts. So it's going to constrict. By constricting but not cutting off completely, it increases the blood pressure. Because again, it's just like wearing tighter clothing. That's going to increase the pressure on your body. And then what it does to this not anatomically correct heart, well, there are actually beta 1 and beta 2 receptors, but beta 1 is the dominant one. And what happens when epinephrine and norepinephrine bind to beta 1 adrenergic receptors? They're going to cause the heart to beat faster, so increased heart rate means increased cardiac output. But it's also going to increase the stroke volume, so the heart is going to beat at a faster rate. But it's also going to beat harder, so it's going to do more contractions as well. So that's what we have there. So this is how norepinephrine, so by increasing flow, you increase pressure. By doing that vasoconstriction, you also increase pressure. So the overall effect of epinephrine and norepinephrine, they both increase blood pressure. Now, antidiuretic hormone. Remember to recap our endocrinology part. So it's also called vasopressin. So this is another name for it. So vaso referring to vessels, and pressin. So pressin sounds like pressure, right? So think of it this way. It's like vascular pressure, vessel pressure. So what does ADH do to your blood pressure? Well, it's going to, remember that it's anti-diuretic. What's diuresis? Well, diuresis is the production of urine. And what happens every time you urinate? You lose water, you lose fluid. Thereby, what happens to the pressure in your plumbing if water starts leaking out of it? The pressure drops, right? Or if you have a water balloon, what if you put a little pinprick and let the water leak from that? The pressure in the balloon starts to drop lower and lower and lower, right? So if you have antidiuretic hormone, you're going to inhibit the water loss. So again, diuresis is going to cause loss of water, loss of volume, and loss of pressure. Antidiuretic hormone is going to do the exact opposite. So what are you going to do? You're going to retain water. You're going to retain your blood volume or increase it if you start to drink more. And you're also going to increase your blood pressure. So overall increase in blood fluid volume means an overall increase in pressure. So that's why also things like, so yeah, this is why water retention, if someone's retaining a lot of water and they're not getting rid of their water fast enough, they can build up their blood pressure. So that's why sometimes they give diuretics, drugs that induce the production of urine to help lower blood pressure. So it kind of opposes the antidiuretic hormone. And this, oh geez, this is very complicated. This is the, I don't think even OpenStax has an image that tries to graph the renin, angiotensin, aldosterone system. But I think Encyclopedia Britannica does have a nicer version of this. So I think this is a little more accessible. So what it's getting at is that angiotensin 2, this hormone that's very important in regulating your blood pressure, is also linked to aldosterone. It's missing one part from the previous picture. So ADH is also involved in this as well. So as we established, ADH causes you to retain water, thereby maintaining or increasing your blood pressure. So all these organs are involved in secreting hormones or enzymes that increase your blood pressure. So this is like, I think this is a good starting point for this class. And much more accessible than the previous slide. Yeah, because like OpenStax doesn't have that any sort of image like either of those images. Okay, so aldosterone, so it's a mineralocorticoid. So it affects, well, it affects potassium as well, but in terms of blood pressure, you should definitely know its effects on sodium. So again, what is this? Is it a steroid, as a peptide, or as a monoamine? Well, again, one of my favorite classes of hormones. So again, 1, 2, 3, 4, 3 hexagons and a pentagon. It's definitely a steroid. Yep. So what does it do? It targets the kidneys and it affects potassium, but for blood pressure, what it does is tells the kidneys to reabsorb sodium and reabsorb water. Now, retaining water and reabsorbing water, we established from anti-diuretic hormone, by retaining water and increasing your fluid volume, that increases the pressure. Just like if you fill up a water balloon with more water, there's more pressure inside that balloon. Now, by increasing sodium, what does that do? Well, the thing is that increasing the sodium increases the osmolarity in your blood plasma. So it makes your blood plasma saltier, right? So what does that do? Well, remember that if you have two subfluids and the membrane separating them, where is the water going to go? To the saltier side or the less salty side? It's going to go to the saltier side, right? So by increasing the sodium concentration, by increasing this osmolarity of your plasma, you increase the BCOP of your plasma. Thereby, that means you're going to reabsorb even more water into your plasma and circulatory system. So more water in your vessels and circulatory system means more pressure. So this is why it's crucial to know that aldosterone affects both your water volume and your sodium retention. And the end product is more sodium in your blood, more water in your blood, increased blood pressure.